Okay, we are on. Hey, everyone. Welcome to another episode of the Team Luke Hope for Minds podcast. I'm your host, Jared Samuels, and today I'm on with Katie Pickrell, who's a physical therapist assistant, and she works directly with Luke. So, welcome, Katie.
Hi.
So, my first question is how'd you get involved in physical therapy? Like, what's your story from beginning to now?
Well, I have an aunt that's an OT, and she talked to me about working with PTs, and got to looking into it. And there was a school at South Plains College that was just 20 minutes away from Lubbock, and that's where I was living. And I just started doing research and started observing at PTI. Where I work currently, and it just was a great fit, and everything worked out perfect. And it's been such a blessing that that was so close to Lubbock and just worked out great.
hmm And what kinds of patients do you work with? Is it just brain injury patients, or is it all kinds of patients?
All kinds. We have patients that, had an orthopedic injury, like rolled their ankle or had a knee surgery. And then we have kids that are born with cerebral palsy or Down syndrome, spina bifida, tons of different diagnoses. But TBIs definitely are one of them.
hmm can you talk a little bit more about maybe like meeting Luke and then sort of what you all do with him and work with him on?
Definitely. I met Luke, I guess in January of 2016. It's the first time they came to PTI, and his family has just been wonderful, and he's been wonderful to work with. It's all been a very um, complicated but great journey for everybody. Whenever he first came to us, he was quite a bit smaller than he is now. He's grown a lot since he's come to us, but um, our main priorities for Luke are him being able to structurally be sound, for his joints and muscles to remain functional, and to not lose any range of motion, where whenever he is in an active mood and ready to move around, then he can use those joints and muscles the way that they should be moved. Um, that has been a challenge with us also, is from day to day he has different levels of arousal, and so some days he'll sleep through a whole session and we'll just spend the time stretching, and then other times he's very active and very alert, and we can have him kick balls and punch things and try to kick me off the mat table. He really enjoys whenever we get to play around like that, pretending that it's people that do mean things to him that he gets to kick and punch. And he's very sports motivated. So
uh
Dad will always be like, Luke, you're the Saints kicker. Kick this ball for the Saints. And that gets him fired up, and he really loves doing things like that. But yeah, just keeping his body where it can move the way it's supposed to, keeping him from getting a worse scoliosis. His body is really dependent on gravity. And so whenever he's sitting, especially, gravity just pulls him down, and it makes his spine turn in a way that it shouldn't naturally. And so he's developing this scoliosis. So we're spending a lot of time stretching his back and trying to make sure that that stays in a good position where he won't have to have any surgeries in the future.
hmm And so, and like in terms of just like the challenges of or what you're working through, is the level of arousal the really big thing that just determines how you go about a specific session, or is it like how he's moving, or other?
Yes, definitely. Both. If he's coming in and he's alert and he's moving arms more than legs, then we'll work on arms more than legs. Or if his legs are really active, then we'll do a lot of standing and kicking and laying down on the mat trying to kick me off, those kind of things. But like I said, if he's sleepy and maybe if he had a hard night and had to have some medication to sleep that night or something, then that definitely affects how much he's able to actively do. And we'll just spend more time working on joint integrity and muscle length than those kind of things.
Mm-hmm. In terms of like other TBI patients you've seen, what are some like maybe consistencies that you see across the board, and ways that like a parent like Tim could work with their child maybe that has had a TBI?
I think really the motivation is the big thing for TBI patients because they have such a hard time moving their bodies and being able to communicate. And so, gosh, I can't imagine how frustrating that would be for me. So for them, being able to keep that ongoing motivation, being hopeful that they can make progress is the biggest thing for them. So just keeping a positive attitude and keep encouraging and finding things that really interest them and motivate them. I think that's the biggest deal for sure for the whole area and speech OTPT just generally in life.
Hmm. Yeah, no, just a little background. I actually had a brain injury myself, which is how I got involved. And I remember I couldn't walk around the hospital floor. So it's kind of my motivation to just try to be able to walk around the whole floor and then get faster at it.
That's
And that's
awesome.
just kind of where it started. Well, in terms of like measuring Luke's improvement or measuring anyone that has a brain injury, like how do you measure that? Is it just like a something you just look at and you can notice, okay, he's improving here, or is there a lot of like different tools or like what's going on there?
Definitely, our goals are based around him being able to have full range of motion in certain joints. So we'll measure that at each different progress summary, which we usually do every 60 days. Um, and so we'll keep up with the measurements that way. And then we also have several active goals for him being able to extend his legs to stand up so many times and hold his head up for a certain amount of seconds with minimal support to max support, just depending on the day that he has. So we'll just periodically compare how he's doing over that time period,
Hmm.
which he is doing so much better with holding his head up. That's been a lot more consistent lately. He's been able to do it for over a minute sometimes, depending on what he's interested in that day and his arousal level.
Hmm. For you personally, what's like the most rewarding part of doing the job that you're doing?
Seeing a kid be proud of themselves for accomplishing something that they didn't think they could do, or um, feeling the pride that they feel whenever their parent is cheering for them because they just did something really exciting, or um, really just the successful part of it, having to work so hard, doing so many repetitions, and then for it to finally pay off. That is just the best thing.
Hmm. And we've talked to a lot of other brain injury patients, and a lot of them want to become a physical therapist and help other kids that have been that deal with TBI issues. So, how would you suggest they go about, taking that journey and beginning the steps towards becoming a physical therapist and working with TBI patients?
Well, starting as a kid, I would for sure just get involved in lots of science things, learn about the body and how it works and what the muscles do, what the muscles' names are. Um, they have a lot of fun, like puzzles and, little science booklets and stuff that you can get as a kid. That would be the best. Once you get a little bit older, I think the youngest that we can accept to observe at our clinic is 18. Um, to be able to go into a clinic and just watch and spend time with the therapist with other kids and see how they're interacting in the things that they're doing. A lot of times when people come to observe, then they'll decide that they really love it and they really want to do it, or they'll decide that this is just not for them.
Hmm.
um, but yeah, I would definitely spend lots of time observing different facilities. And then from there reaching out to different schools, finding out what classes you need to take, and then applying to as many as you think are good for your lifestyle and where you live, and yeah,
Hmm.
going
When
from.
you first started, like when did you realize, like what spoke to you about it that you realize, okay, this is what I want to do?
Really just kind of what I mentioned before, seeing
Hmm.
kids struggling so much with something and then working on it several times and finally figuring out how to make their body do this thing they're trying to do is just just this overwhelming feeling of satisfaction that you got to witness this cool new thing they can do. So that really drove me into wanting to help. I am generally a very patient person, so all of the angry or stubborn patients that I encounter, I can
Mhm.
usually wait them out and figure out something that can motivate them, and just persevering through all of that struggle and then coming out on the other side is just so much worth it. And I just feel like my personality is well suited to that for sure.
Mhm. Well, there's a last question we ask everyone, and it's what, and you can, I've go up to three, but if you only have one, and you talked a little about motivation, but what would you suggest for either a patient that has a TBI and that's trying to go through this physical therapy process, or for their parents? What tips would you give them uh, going through this process?
Really, just to be as positive as possible. I know these kids have so many moments of sadness and frustration and anger about these things that are hard for them that shouldn't be hard for them.
Hmm.
So just, comforting and being positive and finding things that motivate them, even the smallest things to do to progress to the bigger goal. Just finding little things to motivate them to want to do that one small thing, and then just building on that
Hmm.
over and over and over again.
Hmm.
Also being consistent. If you are really motivated to do things one day, but then take several days off, then it's really hard for that child to make progress. So, consistency, I feel like, is one of the biggest pieces of making progress.
Hmm. Great. Well, thank you so much. Is there anything else you'd like to touch on, or regarding what you do or what you do with Luke?
I don't think so. It's just been a wonderful experience, and he's such a fighter. He works hard every day. I'm so proud to be a part of his recovery and rehab.
Great. Well, thank you so much for coming on. I really appreciate it.
Thank you.